Hello, I'm Molly Klarman, the director of the MotiMeds Haiti Project. MotiMeds is a telemedicine and medication delivery service that serves pediatric patients during the nighttime hours, including those in Haiti. The service provides pre-emergent care to children 0 to 10 years. Parents with sick children contact MotiMeds and reach a trained provider. The provider performs a virtual exam by phone, and then the provider generates a treatment plan. To support this process, we developed an electronic clinical decision support tool. The tool was designed as a calculator to sit alongside paper or digital records. It is not intended to store personal health information as an electronic medical record does. I'm now going to share a demonstration. The user first selects between a virtual or in-person exam. I'm going to choose virtual for a telemedicine encounter. This is the input information page. The provider will typically work their way through an exam by asking the parent questions and filling in all of the required boxes. I'll go through a common test case. The child is a 9-month-old boy. The weight populates with an estimate using WHO weight for age data. Next is the vital signs. I'm going to mark the temperature as not measured since most families do not have thermometers at home. However, I'm going to select a subjective fever, and I'm going to select not applicable or unsure for respiratory rate. When possible, we try to assist parents to measure this over the phone, but frequently the situation does not allow for it. I'll then select save and continue. I'm going to select no for the danger sign of lethargic unconscious, and no for seizures in the last 24 hours, and yes, able to drink. And then I will select no for concerned about weight, and then again, save and continue. On the problem page, there's a short list of common childhood health problems. The provider selects the problems reported by the parent. So fever is already pre-populated from the first page, and then this child has a respiratory problem. I will check NA unsure box for stridor because the parent doesn't understand what stridor is. The NA unsure box allows the provider to document that an answer may not be reliable, similar to the respiratory rate on the prior page. I'll then select no for wheeze, no for wheeze, no for difficulty breathing, no for head bobbing, no for nasal flaring, no for retractions, yes for congestion, and yes for cough. If this child has no other complaints, I will continue on. But if at any point the parent wants to change their mind and add something, I can go back. So this child also has diarrhea. The parent reported 3 to 5 episodes in the last 24 hours. It started 3 days ago. It's not watery and it has no blood in the stool. So I will collect save and continue. And I have moved on to the dehydration assessment, which is based on WHO guidelines. This child is well alert. Their eyes are normal. They're thirsty. And normal skin pitch. So this is the medication and allergy page. If I tap yes on taking medications, a list of medications that could potentially be included in the specific treatment plan appears by medication class. So here we have antibiotics and fever and pain. I'll check off that this child is taking paracetamol and that they have no allergies. I'll now continue on to the validate page. This page is meant for the provider to take a pause and evaluate if they've entered the necessary information correctly. For this case, there are no additional comments, and I do not need to call the doctor, so there are no final changes. So I will now press calculate. Here is the output page. The top box has a summary of the child's details with a severity assessment. The severity options are mild, moderate, and severe. There's a warning symbol that indicates there's an alert to consider. The next box relays information on danger signs and considerations. This helps providers avoid tunnel vision that may occur in the clinical thought process. For this case, it says to consider sepsis, given that sepsis can have subtle signs in children. The next box provides rehydration recommendations using ORS. This child has no dehydration, but should take fluids for new or ongoing losses. The next box presents specific medications and treatments related to the specific problems. So we have paracetamol for fever, amoxicillin for concern for pneumonia, a respiratory bulb for congestion, zinc for diarrhea, skip that one, and oral rehydration solution for fluid management. The provider can enter the formulation of the medication to calculate a weight-based dose. So I'm going to enter 120 milligrams per 5 milliliters for paracetamol. I'm going to enter 50 milligrams per tablet for zinc and 125 milligrams per 5 milligrams for amoxicillin. And then you can see that I have calculated the dose in grams as well as the volume in milliliters, the frequency and duration that they should take the medication. And then below that, we have the warning box, which says a medication was reported as being taken, and we need to consider this when distributing medications, as the provider may need to update the medication plan. And then finally, we have a box with a recommendation for treatment location. Here it says household delivery with provider. This means the child will receive an in-person exam by a Motivez provider along with medication delivery because they have higher clinical uncertainty. Other options are household with delivery for cases with low clinical uncertainty that do not need escalation, or hospital for cases that are severe and are in need of escalation. And finally, there's a follow-up recommendation based on the clinical situation. For this case, we see that the patient is required to go to clinic in the morning. This video is intended to be used as a demonstration of the clinical decision support tool and not for other purposes. This tool digitizes a clinical guideline derived from WHO recommendations that has been evaluated in a clinical research context. The recommendations are for patients 10 years and younger with non-emergent medical problems. If the problem has complications or is outside the scope of the tool, medical consult should be sought. So this is the end of the presentation, and feel free to contact us. I can be contacted at mclarman@ufl.edu, or my colleague Eric Nelson can be contacted at eric.nelson@ufl.edu if you have any questions. Thank you.